Okay, so next I am going to look at Garrett's ears. So I'm going to look at its placement on the head, and then I'm going to go ahead and look at the ears. I'm going to note the overall helix, the auricle, the tragus, and then the mastoid bone, and just palpate all of those for any tenderness. Before inserting an otoscope, I'm going to want to just tug on the ear a little bit and make sure that, do you have any pain with that at all? Perfect. So just making sure that there's not any inflammation where I would hurt him at all. And then just note any lesions or discharge as well from that. So then I'm going to take my otoscope and I'm going to hold it off to the side like this. I'm going to use my pinky to kind of relax it on the back of the head. And when you insert the otoscope, you just want to make sure that it's big enough to fit within the canal, but not too big that it's causing any damage. So I'm going to turn on the light and I'm going to pull the ear up and back for an adult, and I would pull it down and back for a patient that's 3 years or younger. Then once I'm in the ear, I'm going to look again for any lesions, any erythema. First of all, the cerumen, and looking at any wax in there. And then once I get my vision good, I'm going to go ahead and look at the pearly gray tympanic membrane. I'm going to note my light and what number that is at on the clock for it, and the cone of light, sorry. And then I'm going to look at the overall long handle, the malleus, the umbo, and the annulus or the rim on that. So during this ear exam, we can also test cranial nerve 8. So to test cranial nerve 8, I'm going to go ahead, I'm going to cover Garrett's left ear and stand to the left side of him. And then about from arm distance away, I'm just going to whisper 1, 2, 3. Can you repeat back what I said?
1, 2, 3.
Perfect. So that is testing, that is the whispered voice test. And then I can perform the RIN test. So that is where I am using a tuning fork and just lightly striking the tuning fork and placing it on the top of the head or the forehead. So on the top of the head. And Garrett, what side do you hear that on?
Both.
Perfect. So that's, I just want to make sure that I'm not prompting him that he should be able to hear on both, but rather that he's telling me he can hear both on his own. And if I thought he was making something up, that he wasn't telling the truth with the exam, I could cover this ear and he should hear better with whichever ear is covered. So that is the Weber test. Sorry, I think I said that was the RIN test, but this was the Weber test. And then the RIN test is when I take the tuning fork and I lightly stroke it again, and I'm going to go ahead and put it on the bone behind the ear, the mastoid bone, and Garrett should be able to, I'm going to watch on the clock, and you tell me when you can't hear it anymore.
Okay.
Okay, and then I'll take it, and I will have the tuning forks with the fork outwards, just a couple inches from his ear, and then this should last twice as long, and that is saying that bone conductance is twice as long, or no, that air conduction is twice as long as the bone conduction. He should be able to continue hearing that. Were you able to continue hearing that okay?
Yeah, twice as long.
Okay, perfect. So cranial nerve 8 is intact for Garrett. Then I'm going to look at your nose, Garrett. So I'm going to look again at the overall shape. I'm going to look for symmetry, for any tenderness, and then I can use my otoscope and shine the light into the nose, into the nares, and then I'm going to look at the overall mucous membranes in there, look for any yawning. I'm going to look at if you're symmetric for your septum, and I know that you're not very symmetric, a little bit more on that right side. It's hard to get in a great view of the turbinates, but I would make sure that those are clear, and then I would look for any polyps or edema. So then I would have Garrett, you could just test the patency of your nares, so if you could blow out on one side and blow out on the other side, and everything went great for you there, perfect. Okay, and then we're gonna look at your mouth. So we're gonna start at the lips. So the lips, we're gonna look for the color we're gonna look that it has a nice distinct border. We're gonna look at the overall moisture content. Then I'll have you open the mouth. Okay, perfect. And here I'm just gonna note how the uvula is looking in there, the soft and the hard palate. I'm gonna look at the tongue and look at the papilla on those. I'm gonna look at the Wharton's and the Stenson ducts. So the Wharton's ducts are the ones on the bottom of the tongue area down there, and the Stenson ducts are on the sides of those inner cheeks. Perfect. And I would be using my tongue depressor to be looking and palpating inside of there. While I'm in there, Garrett, I want to look at your tonsils. Can you say hi? Okay, so I'd use the tongue blade to push down, and then I would have a light so I could see Garrett's tonsils really good. And what I'm looking for is grades 1 through 4 of the tonsils. So grade 1 is it's less than 25% of the oropharynx. Grade 2 is 25 to 50% of the oropharynx. And grade 3 is, grade 1 is less than 25, grade 2 is 25 to 75, grade 3 is 75, and grade 4 is past 75? Yeah. Okay. Grade 1, less than 25, 25 to 50, 3 more. Okay, we'll work on that. And then we're gonna look at the movement of your uvula. I'm gonna have you say ah. All right, and that's assessing cranial nerve 9. Cranial nerve 10, I would just use the tongue blade and you could hit the back of the oropharynx and they should gag. And then the hypoglossal nerve, and you stick that tongue out to midline. Perfect. Okay. Okay, and then we are going to look at Garrett's neck. So we're going to look at the overall symmetry. I'm going to look for any masses. Again, we're going to palpate. There we go. And just make sure that there's no tenderness at all. Everything feel okay to you there?
Mm-hmm.
Okay. And then we are going to look at Garrett's trachea and make sure that's midline. So, and I should just be able to easily push it from side to side. Good. And then we can look at the thyroid. So you can do that either from the side or the front. And I would have him use his water at this time. And can you swallow for me? Perfect. So I felt that isthmus moving up, and swallow again. And I'm just palpating for any nodules on the thyroid, any enlargement. Let's see, its consistency, and if you have any overall tenderness and its shape and size.
No tenderness.
Okay, then I'm going to check your carotid arteries. So I'm going to check on your left side, and then I would check, I would come over and do it on the right side as well, and just making sure that I don't do them at the same time. I'm going to check for any jugular vein distension, which I don't see any at this time. And then the last is the cranial nerve 11, the spinal accessory. So that is making sure you can shrug your shoulders, move your head side to side, and front and back. Okay, and I think you passed our full head, ear, eyes, neck, and throat exam, as well as the skin exam.
Thank you.